Good afternoon, everyone. Thank you for making time to join today's health talk. My name is Dr. NATHIFA, medical doctor at HealthX. Let's take a minute and wait for more people to join. Yeah. Good afternoon. 30 more seconds for more people to join in. And please, if you have any questions as we go on, feel free to chat in the chat box. More people are joining in on all our social media platforms. 10 more seconds, then we can start. All right, I think we can go ahead and start on today's health talk. As I had mentioned earlier, my name is Dr. NATHIFA, medical doctor at HealthX, where our vision is a doctor for every Kenyan. So today we'll be talking about cervical cancer awareness. As we all know, January is the month for creating awareness for cervical cancer, and it's a highly preventable cancer and easily treatable when it's detected early. The prognosis for cervical cancer once caught early is more than 90%. But as it progresses and if it's diagnosed late, the outcomes are usually not so good. So this health talk is just to create more awareness on what signs and symptoms you shouldn't ignore and when you should seek healthcare. So what is cervical cancer? Cervical cancer basically is cancer of the cervix. Cervix is part of the reproductive organs in females. And cervical cancer is basically an abnormal overgrowth of cervical cells, usually caused by human papillomavirus. Human papillomavirus is an STI, is a sexually transmitted infection. And for people who are sexually active, more than 90% of the people have contracted it and have probably, the immune system has overcome it. In the other 10%, it usually doesn't clear and it can lead to cervical cancer. So awareness is really important because it's highly preventable. And as we all know, cervical cancer is like the fourth leading cancer in women, with very high morbidity and mortality rates still in the developing countries. So for how does it happen? What puts you at risk of this cervical cancer? So as I've discussed and as I've said, it's mainly caused by this human papillomavirus. What makes you at risk of getting this human papillomavirus? Things like early sexual debut, multiple sexual partners. If you have a partner who has multiple sexual partners, also puts you at risk. Smoking is a big one because it's a driver of inflammation, and it's implicated in a lot of cancers. Yeah, there's really no benefit of smoking, and we usually recommend cessation of smoking. If you're trying to stop smoking, we have psychologists who are trained in substance abuse disorder, and they can help you come off of it because it's really implicated in most of the actually all cancers. Smoking puts you at a higher risk. Yeah. So things that put you at risk: early sexual debut, multiple sexual partners, smoking, and also immunosuppression. For immunosuppression, basically it's when your immune system is weakened. It can be weakened by a couple of things. Yeah. At the top of my head, what comes up is HIV, human immunodeficiency virus. So if you have HIV and then you get this human papilloma virus and you're not able to clear it, chances of it developing into cervical cancer is very high. And we'll talk about screening for people who have HIV. They have a special screening pattern. They usually have the frequency is a bit different compared to people who don't have HIV. Other immunosuppression states can include things like if you have cancer, it means your immune system is really not able to, other cancers other than cervical cancer, you're not able to fight the human papilloma virus. The other thing is nutritional deficiencies, and this is a big one, yeah? If you're deficient in your nutrition, in what you're eating, and we all know like your immune system comes from what you're eating, it can be difficult for you to clear the human papilloma virus. So like just a recap, cervical cancer is basically an abnormal growth of cervical cells. Usually arises if you're infected with human papilloma virus that doesn't clear naturally. This is why we recommend screening for this human papilloma virus and also doing pap smears, yeah? So, because human papilloma virus is what's highly implicated in cervical cancer. How would you know if you have symptoms that are suggestive of cervical cancer? So usually cervical cancer at the beginning, it's very, very silent, yeah? It's almost like hypertension. There are no symptoms. There's no one symptoms that can tell you you have cervical cancer at the early stages, yeah? So initially it's very asymptomatic. That's why we recommend routine screening, yeah? So as it progresses, the main symptom that people usually have is something we call postcoital bleeding. Bleeding after a sexual contact or bleeding after sexual intercourse. That's usually the main telltale sign that you'll present with, yeah? So postcoital bleeding, bleeding after sexual intercourse. Other symptoms are things like abnormal discharge, usually watery and it's foul smelling, yeah? Pain during sex, dyspareunia can also be a symptom. Abnormal heaviness within the cervix, it means maybe the cervix is overgrowing, yeah? But the main symptom that usually most people present with is the postcoital bleeding, which is bleeding after sexual intercourse, yeah? And that's usually a very big one. As this cancer progresses and it goes and involves other organs, because usually it's, when it starts, it's usually localized within the cervix, so it's just within the cervix. As the growth becomes more and more, it will now grow and involve other tissues, yeah? So if it goes to the rectum, you might have issues with going for long haul. If you, like maybe constipation or blood in stool. If it goes and involves the bladder, you might have issues with when you're going for short haul. Things like blood in urine, yeah? Discomfort when you're going for short haul. So this is when it has progressed. And there's something we call B symptoms in medicine. So if you're starting to feel like you're losing weight, you're experiencing night sweats, all this could be suggestive of cervical cancer. But the first symptom that most people usually present with is postcoital bleeding, bleeding after sexual intercourse. Other symptoms that are usually very early on are things like your intermenstrual bleeding. Like you usually have your menses, yeah, but now you're bleeding in between your menses, yeah? Abnormal menstrual bleeding, yeah? That can also be a symptom of cervical cancer. So for signs and symptoms, that's usually what's there. We have symptoms that are localized within the cervix, and if this cancer spreads to other organs that are nearby, the rectum, the bladder are usually the ones affected. Usually as it spreads, the outcomes usually are not that good. So we want to catch it early when it's still in the cervix, yeah? So since, as we've mentioned earlier, the signs and symptoms are usually not there, yeah? What should you do? This is why we recommend pap smears. Pap smear, I know a lot of people are worried. There's a lot of discourse when people are coming for consults. They're like, I'm afraid of this pap smear test. I'm afraid it's going to be painful. Proper education on what this pap smear test involves really helps in alleviating anxiety amongst women, and also like making them accept this screening test. So what is a pap smear test? Basically, it's a test that screens for cervical cancer. When you go to your doctor or your primary practitioner, they'll explain to you what the procedure involves, but I can just do like a snapshot of what it involves, which is you go there, they'll put you on, they'll make you lie on your back, basically supine, and in lithotomy position. They'll expose you, and then they'll clean the external genitalia, and then they'll insert something called a speculum. So usually the fear is this speculum insertion painful? No, it's not. So there are different kinds of speculum that can be used. There's the plastic ones and there's the metallic ones. They're really not painful. You might feel some discomfort, but it's really, and the test doesn't take so long, maximum 5 minutes, yeah? So once they put the speculum to visualize where the cervix is, they're able to collect the sample, yeah? And that sample is taken to the lab to be looked at under a microscope, something we call histology. And there they can be able to detect if there's any abnormality within the cells of the cervix. So it's usually like a very brief procedure. You don't need anesthesia. It's really not painful. It's quick. You wouldn't even know when it started and when it ended, yeah? So I really encourage women who are sexually active between the ages of 21 up to 65 years of age. Please, 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 pap smear is our one tool to detect cervical cancer early, and that's what we really recommend, yeah? And once the results are out, there's usually there's different ways we're going to tell you to like screen for it. So screening will depend on your status. As I had mentioned earlier, people who are immunocompromised, people who have HIV, their screening is more regular. With the different sources will recommend annually. So if you have HIV or if you're immunosuppressed, they'll recommend you do the pap smear every year. For women who are okay, they don't have any immunosuppression, we recommend you do the pap smear every 3 years. Yeah. So the pap smear does not only tell us if there's presence or absence of cells that are suggestive of cervical cancer. It can tell us more. Yeah. I know many women struggle with pH issues, vaginal pH issues, and we're able to detect even during a pap smear, but that's usually not the indication for doing a pap smear. Yeah. So if you've been having abnormal discharge, you're very wary of, is this cancer or not? The best bet would be doing a pap smear. So once the results are out for pap smear, I think the trend has been, we've seen most women don't have cells that are suggestive of cervical cancer, but there's disruption in your pH. So there's a shift in your normal flora. Normal flora is basically the normal bacteria within the cervix, yeah? So if there's a shift in that, you end up getting discharge, yeah? So in most cases, we've diagnosed a lot of bacterial vaginosis using a pap smear, yeah? And I know there'll be questions about BV, bacterial vaginosis, but usually the discharge for bacterial vaginosis is usually fish-like smell. It's very characteristic. The smell is very characteristic, yeah? And it usually tells us a lot about what's happening with your pH. And there are usually different ways we can manage. So in some cases, we usually end up giving antibiotics to clear the infection, the bacterial vaginosis. And in other cases, if somebody is not symptomatic, we usually recommend lifestyle changes in terms of things like no douching, avoid inserting things within the vagina, things like tampons that have fragrance, like wiping front to back, all those basic, we'll go back to basics, yeah? Because it's basically disruption of your pH. Also, overuse of antibiotics People usually just go and get over-the-counter antibiotics whenever they have a flu. It can lead to a disruption in the pH within your vagina, and it can lead to bacterial vaginosis. But bacterial vaginosis is usually very characteristic. The discharge is usually like fish-like smell, and usually have symptoms like itchiness and just overall discomfort, yeah? So basically, I think that's about it in cervical cancer. There's also a role for, so when you talk about prevention of cervical cancer, there's role for HPV vaccine, human papilloma virus vaccine. As I had mentioned earlier, HPV infection or human papilloma virus infection is usually the causative agent in cervical cancer when it's not cleared. So there are vaccines that are created against the high-risk strain, which are usually 16 and 18, to give you like immunity so that when you get this infection, you have like memory cells that can fight the infection. It's usually best given if you've not had any sexual contact. That's why we see in government putting efforts in vaccinating children, school-going girls between the ages of from 9, 11, they're about from 9 years of age. They've started rolling out the programs in vaccinating them. But if you've had, if you've already like had sexual intercourse, you can do the HPV antibody testing, and if there are none, you can be given the vaccine. So basically, HPV vaccine really plays a big role, especially also in immunocompromised patients who have they're in immunocompromised state. They can also be given the HPV vaccine. Most people, almost 90% of people who are sexually active have gotten this infection, this human papilloma virus, and their body is able to like clear it if they're in if their immune system is good and in check. Yeah, so this is something that's very common. The issue is that if it's not cleared, it can take a while for it to develop into cervical cancer, but it's usually like implicated in cervical cancer pathophysiology. The other thing is using protection barrier methods like condoms when you're at risk. Yeah, if you're having multiple partners, just wear a condom. It's going to help in it's going to help you in not contracting these STIs, and in particular HPV, human papilloma virus. I think that's it. I don't know if there are any questions, but just a recap. Cervical cancer is highly, highly preventable, and its prognosis after you've been diagnosed with it in the early stages is almost like 90 and above. Yeah, so we're able to like treat it. There are also like different treatment modalities depending with the stage in which this cervical cancer has been, the stage in which you've been diagnosed with. So if it's caught early, as I had mentioned, like it's very treatable. Yeah, it can be like 100% like treatable if it's caught early. There's different treatment modalities depending with the staging. Usually, if it's caught early, usually the gynecologist would recommend doing things like loop incision, cryotherapy, and all that. If it's caught early, yeah. If it has spread to other organs, there's role for chemo and radiotherapy. But we want to catch it early because we've seen it's highly, highly curable if it's caught early. And also like the screening, yeah. We are recommending every 3 years if you've had a normal pap smear and you're immunocompetent. And if you're in an immunosuppressed state, we recommend every year. I don't know if there are any questions, but yeah, that's the basics when we talk about cervical cancer. What causes it? What are the symptoms you should watch out for? And how is it prevented and how it's treated once it's caught? Yeah. I think that would be my message to everyone. It's highly treatable, highly preventable, and how can we catch it early? It's by doing pap smears. And pap smears are not something to be afraid of. I can reassure you, being somebody who's had a pap smear done and also having done pap smears on patients, it's really not painful. I don't know if there are any questions. Please feel free to post the questions on the chat box. Maybe I can recap for people who had joined a bit late. Cervical cancer is basically an abnormal overgrowth of cells within the cervix, usually caused by human papilloma virus. This human papilloma virus is usually like sexually transmitted, and if you are in an immunosuppressed state, it can end up developing into cervical cancer. Symptoms you should watch out for are things like bleeding after sexual intercourse, abnormal discharge, in menstrual irregularities, pain during sex, and if it spreads to other organs, now you end up having symptoms that are involving the organs that it has spread to, like if it's in the rectum, the bladder. It can also spread to other distant organs, not just the organs within the reproductive system. Yeah, that's on symptoms you should watch out for. Screening, we recommend pap smear. You can get it anywhere, even in the public hospitals. Yeah. And it's highly sensitive and highly specific for cervical cancer. Yeah. And it's not painful. Treatment, if it's caught early, you can get up to 99%, like it's curable if it's caught early. Yeah. But if it has advanced to other organs, the prognosis and the outcome is really not that good. So we want to catch it early. Prevention, HPV, there's a role for HPV vaccine. Yeah. Cessation of smoking, as I had mentioned. Cigarette smoking it drives inflammation. So cessation of smoking is a big one. And also like barrier methods during sexual intercourse to prevent your risk of getting or contracting STIs, especially human papilloma virus. Anyone with questions, comments, clarification? I've seen one question has popped up. John Kimura, thank you for your question. He says, Doc, that was very eye-opening, though also scary. What can we do to lower the risk of getting the condition? Thank you so much, John, for asking this question. I don't want it to be scary. This is just to create awareness. I am sorry, maybe my delivery wasn't that good. But cervical cancer is highly preventable. I think that should reassure a lot of people. Highly preventable and highly treatable if it's caught early. Yeah. How can one lower the risk of getting the condition? Like basically, how do you prevent yourself from getting the condition? If you're smoking, we go back to the risk factors. What puts you at risk of getting this cervical cancer? So if you're smoking, we recommend cessation of smoking. Yeah. Smoking has really no benefit. There's no benefit in smoking. It basically just drives inflammation and all the bad things within the body. So we recommend cessation of smoking. And if you find it like you're struggling with this smoking issue, you can give us a call on our toll-free number. We can help you. We have clinical psychologists who are highly trained in substance use disorder, and they can help you come off this smoking issue. The other thing is getting a pap smear check depending with your immune state. We recommend every 3 years if it was a normal pap smear and if your immune system is intact. But if your immune system, maybe you have a HIV or any other condition, we recommend every year. Yeah. So pap smear is the only way we can tell if there's early changes within the cervix. Yeah. We don't want to wait for symptoms. We want to catch it early, even before the symptoms appear. So every 3 years for those who are immunocompetent that they've had a normal pap smear, and every year for those who are immunosuppressed, maybe from HIV. If you are at risk of, if maybe you have multiple sexual partners, we recommend using barrier method, yeah, basically condoms during sexual intercourse, yeah. And then don't ignore the symptoms you're feeling. Usipuuze, don't ignore them. Anything small, anything you feel like, hey, I feel like I need to go see a doctor, please do, yeah. And as I've said, pap smears are not painful. Yeah, the other thing you can do to lower your risk is HPV vaccine, human papillomavirus vaccine. So this vaccine, basically, if you've never had any sexual intercourse, or if you've never had any sexual intercourse, you can come get it, yeah? But if you've had, we can test for this virus, yeah? We can test for the antibodies, and if they're not there, because most people have gotten the antibodies, like the immune system already recognizes this and it has fought it if you're sexually active. If you don't have the antibodies within your body, we can give you the vaccine. Usually the vaccine is given, depending, it can be given up to 3 times in a year. There's usually a schedule for it. Yeah, so basically, how do you lower your risk? Doing the pap smear check, screening, using a pap smear, not ignoring any symptoms that you're feeling could be off. If you're smoking, please stop smoking, and also condoms during sexual intercourse if you have multiple sexual partners. Irene Modoni, thank you for your question. Irene is asking, does HealthX offer HPV vaccine? As of now, currently, no, we don't have any vaccination program currently, but we're in the process of enrolling. So once we do that, we will inform everyone on all our social media platforms so that they can come and get it from our head office. Rebuma Sosa asks, is the HPV transmitted to males during coitus? Yes, yes. So this HPV is transmitted sexually, if the male has it, they can easily transmit it to the female, and if the female has it, vice versa, she can also transmit it to the male, yeah? So it's sexually transmitted infection. But the good thing is that most people clear it out of their body. Their immune system is able to clear it, and it doesn't lead to issues. In 10% of the people, it can develop into cervical cancer over the years. So that's why we are recommending the routine screening with pap smear. Yeah, so it is transmitted during sexual intercourse, and also males can get it. And they can also be carriers, so when they're having sex with another partner, they can also transmit it to them. Yeah. I hope I've answered the questions. And I don't want it to come off as something that is scary. This is just like a friendly conversation, just a reminder, it's January, let's have our pap smears for all the women, let's check our status, let's do the pap smears, yeah, just to know where we are at. And if it's normal, well and good. If it's abnormal, there are resources there to help you, yeah. We have trained gynecologists in Kenya who are able to know depending with what abnormality is detected. So the key takeaway from this is, please get that pap smear you've been putting away. Please just get it done. The other day I was on one of the social media platforms, and there was a random girl just raising awareness on how she did, she was giving like awareness and saying how she went for the pap smear. It wasn't what she expected. She thought it's going to be very painful. It wasn't. And it was very brief, like maximum 10 minutes. But the whole procedure, let's say like 5 minutes, the actual taking of the sample. But the whole setup took her 10 minutes, and her results were out within 2 weeks. And she was able to know like where she lies at, yeah? She was worried that she's been having discharge, yeah? And she decided not to put it like away. So she got it checked. And that I was like really happy, because so many people were commenting about their fears on this pap smear thing, but she was like raising awareness. And she's not even a medical doctor. So I'm really loving this conversations that are happening online, yeah? Rebuma is also asking, in most of African countries, the vaccine is given only for females. So why males are not included? Screening means in males. So I think in African countries, because there's a lot of limited resources, we prioritize those who are at risk, yeah? So, and the government has rolled out programs that's targeting those who've not had any sexual intercourse. So school-going girls, that's where we are starting at, because vaccines work best if you've not had the infection. So that in case you get the infection, your cells, your body will have memory, and it should be able to like clear it, yeah? So basically, the reason why females are prioritized, one, because they're the ones who are affected, yeah? They're the ones who are getting the cervical cancer, yeah? So that's why it's prioritized. And it's usually prioritized because of the cost of this vaccine. It's the school-going kids who are prioritized, and those who are immunosuppressed. That's why it's given to them. But hopefully, as time goes by, the government will be able to like roll it out to even people who've people who've already had sexual contact, yeah? Females, because they're the ones who are affected, if they get the HPV virus, for them, if it's not cleared with the body, it actually can easily transform into cervical cancer. So that's why females are targeted. In males, they usually they don't have symptoms. It's usually, for them, they'd be carriers. So that's why a lot of resources is put into the females, because they're the ones, because of the burden of this cervical cancer, they're the ones who are usually like affected with it. Yeah, I hope I've answered your question. But also, screening can be done in males if they have the resources. You can just go and get the HPV test done and see where you're at. But most people who've had sexual intercourse, most likely they've contracted it, and their body has like cleared it. And almost 90%, that is from statistics, yeah? Your body like naturally like clears it out. You're able to like fight it, but now it becomes a problem in those who are not able to fight it. Then it develops into cervical cancer. These are really good questions. I love them. Keep them coming. So I'll mention this again because it's very important. Early on in cervical cancer, there are usually no symptoms, yeah? This is why we keep on repeating pap smears, there are no symptoms. Pap smear is like the best tool to detect if there are any changes within the cervix, yeah? When symptoms are starting to develop, you should not ignore these symptoms, yeah? You can give us a call, have a chat with the doctor over the phone, over video, yeah? Just talk to us. This is a safe space, yeah? And we'll be able to give you like the best advice on what you should do, yeah? If it's a pap smear that you need, we have partner labs we can send you and get it done, and your results will be out within 10 days. And yeah, we're able to like help you. So we don't want to wait for symptoms. And the main symptoms that usually happens is bleeding after sexual intercourse, abnormal discharge, pain during sex, yeah? Intermenstrual bleeds, All these are symptoms that you shouldn't ignore if you've been experiencing. Please, please give us a call. Even today, we have doctors in our call center. You can give us a call just to, we see what we can do for you. But the best tool in detecting cervical cancer is pap smear, because pap smear is highly treatable and highly preventable. Yeah. Thank you, Rebuma, for that comment. Maybe I can discuss again about bacterial vaginosis. It's basically an imbalance within the pH. Also, we've had pap smear reports that usually says there's usually when pap smear reports come out, the first thing is they'll comment about if there's any evidence of cancer, yeah? And also if there are any other changes within the cervix or within the vagina. So usually, most of them that we've seen, it's like disruption in the normal flora, yeah? And this normal flora is basically the good bacteria within the vagina and within the vaginal canal. If there's disruption in that, you'll end up having symptoms. BV is the most common, bacterial vaginosis is the most common infection that you get if there's disruption of your normal flora or your normal pH. So you end up with a fishy smell and a discharge that's usually very uncomfortable. It makes people very uncomfortable, but it's easily treatable. We have meds for that. We have lifestyle changes, yeah. No douching, avoid putting things within the vaginal canal, also that have fragrance, avoid using soaps. Just plain water is enough to wash your external genitalia. You don't need to use fancy things. The vagina has its own cleansing mechanisms. Yeah, you don't need to use anything special. It's easily treatable. Keep the questions coming. I'm here for them. Any queries, anything you'd like to know. This is a free space. So also what I'd like to encourage is safe sexual practices, yeah? If you know you're at risk, please don't put others at risk. Please wear protection, yeah? There are also like female condoms, not just the male condoms. Because we've seen this cervical cancer, you can get it from HPV, which is sexually transmitted, yeah? So safe sexual practices. That's what I'd also recommend in part of prevention. Yeah. If you've not had any sexual contact, it would be good if you get the HPV vaccine. It's going to protect you in case you get the HPV infection. A final recap is that cervical cancer is highly treatable. I want you guys, like, if there's anything you're going to take away from this session, is that cervical cancer is highly treatable, highly preventable, and how you're going to prepare yourself in combating this cancer is by doing your annual checks, doing that pap smear that you've been putting away, yeah? Let's not ignore like the symptoms you're experiencing. Always feel free to speak to your doctor, or you can even call us in case you're experiencing any of the symptoms that we've been mentioning. Yeah, and it's something that if caught early, the outcomes are really, really good. Yeah, we don't want to get somebody when it has spread to other organs. They're having now liver failure, they're unable to breathe. We don't want to catch it that late. We want to catch it early. And remember, it doesn't have any symptoms early on. The only way we can detect it is through screening, and that is pap smear. All right, thank you everyone for joining. Thank you for making this an interactive session. If you have if you need any clarification or you need any questions answered, please feel free to reach us on our toll-free number, which is 0800 720 795. We have doctors working round the clock, 24 hours. We are here for you. Feel free to give us a call. You can also download our app on Google Play Store and also the App Store for Apple. And you can chat with a doctor through chat and also video call. We are here for you. And let's raise awareness for those people who are not here. If you have sisters, if you have mothers, cousins, anyone, just pass the message. That's all that matters. Thank you all. See you soon. Bye.